Back on our show this Monday, and Paula Johnson is with us. She's going to tell us about a behavioral health and wellness educational event that's coming up on Friday. This is a big month.
It is. May is National Mental Health Awareness Month. So NAMI is kicking it off with our Behavioral Health and Wellness Seminar.
Right.
It's going to be Friday.
NAMI means what? And tell us about that organization.
It's National Alliance on Mental Illness. It's the nation's oldest grassroots organization.
Right.
Helps to remove the stigma of mental illness. It's a disease that people suffer with in silence. No one wants to talk about it, but the truth is everybody knows somebody.
And there are big names throughout history who have suffered
Yes.
mental illness.
Very surprising. We all know about Robin Williams and his struggle, but Abraham Lincoln, I didn't know
Churchill,
that. Yes.
Terry Bradshaw I was not aware of, Mike Wallace.
Exactly.
Yeah.
Buzz
So-
Aldrin, that's interesting.
Yeah.
But you know, there is help out there. There are wonderful medications, there are wonderful counseling services. There is help.
Exactly. No one needs to suffer in silence. At the seminar, we're going to have social worker who's going to talk about suicide risk assessments. We have Dr. Booz from the VA that's going to talk about medication or therapy, which is the best. We have Bart Lyles from the state of Louisiana. He's going to talk about different disorders.
Wow.
So health and treatment, it's available.
So it'll be a lot of great information.
A lot
at
of
this
great
seminar.
information. And professionals can get 5 CEU hours, $65, which is an awesome, awesome value. But the seminar is going to be informative. Plus, if you need your continuation hours, you can get them.
But you know, it's really, really unfortunate that a lot of people that we see that are homeless right now are suffering some type of mental illness. A lot of people that are going through the judicial system, especially on the criminal side, are dealing with some sort of mental illness.
That is so true, so true. Behavioral health services have been cut to the bone. So when there's no place to house those people, they end up homeless and they end up committing crimes, or it's perceived that they're committing crimes when they really have a mental illness. That treatment would help. And people with mental illnesses live full, productive lives. The names on those posters were, very productive people.
Right, even Jane Potty, you saw Jane Polly's name on the list. Tell us about, does the organization meet for folks that belong to NAMI? Can the general public belong to NAMI?
The general public can definitely belong to NAMI. We meet the first Monday of every month. So today is actually our meeting day at 4:30 at the VA Medical Center. Membership is open to anyone, family members of someone dealing with a mental illness, professionals, and then we have support groups. We have something called NAMI Connect. It's a support group that meets every Thursday at Longleaf Hospital. It's there to provide support for people who are in recovery from mental illness, to know that you're not alone and know that resources are out there. If you have a family member, you can come to NAMI and see, okay, what resources, and we can give you resources. We also have a phone number that you can call for resources, 318-613-0387, and we'll be glad to talk to somebody, guide them toward resources they may need for themselves or a family member.
Terrific. Help is available out there.
Yes.
Where will the event take place Friday?
It's going to be at the Education Building at Central State Hospital. Signs will be out there to guide the way. And if you haven't pre-registered, it's not too late. We do have on-site registration.
Wonderful. Thanks so much for coming in.
Thanks for coming
Thanks
by.
for having
Great
me.
information.
Yep. More to come. We're going to tell you about the Run for Your Life 5K when we come back.